Welcome to the Outdoor Emergency Care Training Course. This video is the training course that is required for patrollers at Pine Hill. This course will go over many skills required, such as CPR, wounds, splinting, and much more. After completing the video, you will take an exam in order to officially qualify yourself as a patroller. Ski Patrol is responsible for ensuring the safety of skiers on the hill, which includes enforcing skiers to follow the rules, answering questions that they might have, such as about trails, weather conditions, and so forth, and most importantly, helping those in medical emergencies. All patrol members are expected to only perform care that they're trained to do during this course. For example, if you know a skill that is not taught in this course, you should not perform it because it is out of the scope of this training. An example is the acronym ABCD, which is often used during the primary trauma survey, but it is only acceptable to use the ABCD components as taught in this training. A drive is the motorized housing of a lift. A return is the non-motorized housing of a lift. Note that these may be either at the bottom or at the top of the lift. A lift operator, or LO, refers to the individuals who are responsible for operating these lifts. Ski patrols or patrollers are often abbreviated to SP. An operation is a scheduled session that is staffed by Pine Hill staff. Base often refers to dispatch. PR is an abbreviation that we use for Pine River, which is the main detachable lift in the game. Backside refers to the backside of the resort, accessible via the Centennial lift. OEC refers to Outdoor Emergency Care. OET refers to Outdoor Emergency Transport. And triage refers to treating patients which have the most severe injuries, and especially evaluating patients to decide which ones require the most urgent treatment. Ski Patrol is protected by the Good Samaritan Act. It's important to remember that you may only provide care that you are trained to do in this course. Patrol chain of command starts with the Ski Patrol Director, followed by the Assistant Ski Patrol Director, followed by Ski Patrol Supervisors, then Ski Patrollers, and finally Mountain Safety, which is the title that we use to refer to patrol candidates who have not yet been formally certified to be on-mountain patrollers. Lift operations begins with the manager of lift operations, followed by the assistant manager of lift operations, followed by lift operations supervisors, then followed by lift operations crew chiefs or foremen, then lift operators, and finally ticket scanners, which is the title we use to refer to untrained lift operators. The best way to contact someone is to ping them in the dedicated chat for Ski Patrol SP text comms. You should familiarize yourself with the Discord channels. It will not be gone over in this course, but it's important to ensure that you are aware of what's said in staff announcements. All staff are required to use the moderation logs channel whenever a moderation action such as reset, kick, or ban is taken in-game. In the game, you can press M to open the map. There are a variety of important locations that you need to know, such as the Ski Patrol headquarters, lift operations headquarters, lifts like Centennial or Pine River, and the various Ski Patrol shacks. It is recommended to explore the map and understand where everything is located. Staff are granted the ability to use the admin system by pressing F8, and when using, you must log any actions and have permission. You must log all actions you take except for teleporting. It is unlikely for you to use many of the features in the admin panel, such as teleporting. Those features may only be used with permission from a supervisor. Ski Patrol will report to the Ski Patrol Supervisor and not to anyone in lift operations or mountain operations. It is important to note, however, that supervisors outside of your department will still have authority over your actions. Similar to lift operations, patrol will be evaluated once every 2 months on their attendance. There are no strict activity requirements, however, you must dedicate some time to attending operations. All staff are not expected to be active outside of the ski season, such as during spring, summer, or fall. Ski Patrol may not ever operate the lifts. This includes all lifts, the magic carpets, or even pressing the emergency stop. Ski Patrol may not operate lifts during operations or outside of operations. The only exception to this rule is private servers. Ski Patrol may not operate any equipment that they're not authorized to use, in addition to ski lifts. Snowmaking equipment may not be operated by patrollers. Patrollers may not enter lift operations or snowmaking areas unless authorized by a supervisor. If you wish to play the game regularly, you may. However, you may not wear the patroller uniform. If you wish to patrol, you may in public servers. You may not operate snowmobiles or close trails in public servers outside of operations. You may not alter your uniform and must wear the provided and correct uniform. You are allowed to wear a radio accessory. It's common and allowed to wear accessories such as hats, snow goggles, or helmets. Your skin tone must be a realistic color. And you may only wear black and red accessories in order to match the Ski Patrol theme. Professionalism is expected on the group wall and in-game in terms of when you communicate in chat. In order to operate, use a toboggan and snowmobile, you must undergo an outdoor emergency training course. Unless you're certified, you may not operate a snowmobile or toboggan. You will be given a role in the Discord once certified. As a patroller, you are not allowed to give medication to anyone. You must be on a computer when patrolling or attending a Pine Hill-related event. This is because many features are only accessible to computer users and not other devices such as iPads or iPhones. You must be within a time zone where you can easily attend operations that might begin between 6 to 8 p.m. MST, or Mountain Standard Time. If you're in a significantly different time zone, such as GMT, or Greenwich Mean Time, or simply because it's a bad time, you may not be part of patrol and should immediately talk to a Ski Patrol supervisor or above. As a patroller, when responding to an emergency, you will assess it in a specific way. The assessment begins with a scene size-up or an initial impression. After that, you perform a primary assessment. Third, you then take a history from the individual. After that, you can perform a secondary assessment, and finally, you conclude the process with a reassessment of the situation. In subsequent sections of this training, we will go over each of these 5 steps. The goal of a scene size-up is to primarily get a quick general idea of what to expect. Ask yourself, is the scene safe? Do you need to have another patroller stand up the hill and redirect skiers? Do you need to put your skis on the ground to stop oncoming skiers because you're alone? Consider how many patients there are and if you need to triage. And you must always wear PPE. As soon as your skis are off, your gloves should be on. Ask yourself what might have happened in this situation. And finally, consider the patient or patients. What's the age, sex, race? As a case study, a skier was walking to their car, and an electrical pole fell with electrical wires dangling into the puddle under the car. A large piece of metal goes through the windshield, going into the skier's neck where you're able to see major bleeding. It's clear to you that there's a puddle of water under the car, and the electrical pole may have potentially electrified the puddle. What do you do first? You've now sized up the scene. During the secondary, you will do a head-to-toe assessment. But for the primary assessment, you should immediately ask if they have any neck or spine pain, since it could signal a much more serious injury that requires immediate assessment. Go through the ABCDs. A starts with airways. Is their airway clear? And if it is, then you can assume that they're breathing. B is for breathing. Are they actually breathing? If you put your hand in front of their mouth, can you actually feel them breathe? C for circulation. The main way to do this is by checking capillary refill. Press on the patient's finger and then see if it goes back to white within 2 seconds. Anything more than that is considered abnormal circulation. And D, disability. Does the patient potentially have an injury to the nervous system that can cause unresponsiveness, paralysis, or neurological compromise? Once you have determined that there is no life-threatening emergency, you should update dispatch, give a brief rundown on the scenario, and then move on to the secondary assessment. Once you determine that the scene is safe, you may approach the patient. The first thing you should do is introduce yourself and explain that you're with Ski Patrol. You should immediately ask if you can help them. If they say no, you should not help them. However, you should explain the risks of not receiving care in this situation. If they consent, you may proceed. During the secondary assessment, you will go more into the patient's medical history. You should quickly aim to determine what happened and if they have any past medical injuries or history, such as a heart attack or a stroke before. Are you able to gain or surmise anything from this quick assessment? If there's a bike race, for example, and they're profusely sweating, could it be a heat-related illness? Are they laying next to a tree with an open fracture? Could they have hit the tree? After getting a brief idea of what might have happened and a basic medical history, determine the chief complaint and go through sample. S stands for signs and symptoms. How do they feel? And as a patroller, what do you see? A stands for allergies. Are they allergic to any medicine, foods, or animals? M stands for medications. Are they taking any medication? P stands for past medical history. Are they diabetic? And have they had any surgeries or other important underlying medical conditions? L for last oral intake. What did they last eat or drink? And might they have low blood sugar from not eating? E for events leading up to the injury. Did they fall unconscious, then fall, or did they fall and then become unconscious? As an example. As part of the secondary assessment, additionally check their vitals, determine their blood pressure, heart rate, respiratory rate, and body temperature. This is essential to the secondary assessment. During the primary assessment, you should have checked for any spinal or neck pain. If there is any suggestion of that, you should apply a C-collar and consider putting them onto a backboard to stabilize neck movement. After that, you should now begin the head-to-toe assessment. During the assessment, you will look and palpate for anything more than you or the patient might not know of, such as bleeding, broken bones, or swelling. First, remove their helmet. Put your hands on their head, feeling for anything unusual, and then move on to their collarbones, move down their arms, and check to see if they can move their fingers. Go down the chest and check the back. Most importantly, feel the spine for anything unusual. Palpate their lower thighs all the way down to their ankles. You should get them to wiggle their feet in the boot. They will not need to remove any clothing during this process. Once treating their injuries, you should transport them to the medical bay for further treatment and to pass off to a higher level of care. Once you stabilize the patient and complete the other necessary interventions, you should reassess vitals. Determine their blood pressure, heart rate, respiratory rate, and body temperature. Log this information, especially if their health status is declining. At this point, your patient should be ready for transportation. There will be further instructions for transportation through the OET training. Reassess patients every 15 minutes or every 5 minutes if unstable. Once transportation is complete, they will usually arrive direct to EMS or to the Pine Hill Medical Building. If a patient has no pulse and you can confirm this, begin performing CPR. Before starting CPR, kneel beside the patient and bunch your hands together as shown in Figure 1. Compress the chest using straight arms and at least 2 inches deep. The compressions should be around 100 to 120 beats per minute. After 30 compressions, administer 2 breaths directly into the patient's mouth if the patient is an adult. For children and infants, you should use a 15 compressions to 2 breaths ratio. Continue CPR until a pulse has been found or somebody else takes over care. CPR should only be stopped to administer AED shocks or if the patient has regained a pulse. If the patient has regained a pulse, CPR should be stopped and the patient should be placed in the recovery position.
A cardiac emergency can happen anywhere. Be prepared with a simple technique known as compression-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. If someone suddenly collapses, check the scene for safety. Then, check to see if the person responds to you using the shout, tap, shout technique. At the same time, check for breathing, life-threatening bleeding, or another life-threatening condition. Are you okay? Are you okay? If at any time you determine the person is experiencing a life-threatening emergency, call 911 and get the first aid kit and AED or tell someone to do so. Anna, call 911 and get the first aid kit and AED. Then, if they are unresponsive and not breathing or only gasping, begin compression-only CPR. First, ensure that the person is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches and a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Finally, keep going. Continue giving compressions until you notice an obvious sign of life, like breathing, an AED is ready, a trained responder is available to take over compressions, EMS personnel arrive and begin their care of the person, you are alone and too tired to continue, or the scene becomes unsafe. If you would like to learn how to give full CPR and use an AED, you can take an American Red Cross CPR AED course. Check out redcross.org for more information.
Once an AED arrives, it should be attached to the patient and turned on immediately. Once the pads are attached and the AED is turned on, you should immediately analyze the heart rhythm. If the AED has found a shockable rhythm, which it will display on the screen, administer the shock. When the AED is analyzing, or especially when it's shocking, no one should be administering care to the patient.
When a person is in cardiac arrest, early use of an AED can help restore a normal heartbeat. For each minute CPR and defibrillation are delayed, a person's chance of survival decreases by 7 to 10%.
An AED is simple to use. Just turn it on and follow the prompts.
If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts.
Attach pads firmly to person's bare chest as shown.
Remove all clothing covering the chest to place the AED pads and wipe the chest dry if necessary. First, always use adult AED pads on anyone older than 8 years of age and or weighing more than 55 pounds or 25 kilograms. Do not use pediatric AED pads because the shock delivered will not be sufficient. Then, place one pad on the upper right side of the chest. And the other on the lower left side of the chest, a few inches below the left armpit. Follow the diagrams and labeling of where each pad goes. If the AED pad has a feedback device, follow the manufacturer's instructions for use.
Plug-in connector.
Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say clear in a loud, commanding voice.
Don't touch person. Analyzing.
Clear. Be ready to deliver a shock if the AED determines one is needed.
Shock advised. Press flashing shock button.
Again, make sure no one, including you, is touching the person and say clear in a loud, commanding voice. Clear. Push the shock button to deliver a shock and immediately start CPR, beginning with compressions.
Shock delivered. Start
1
CPR.
and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9. You should continue giving CPR cycles until you notice an obvious sign of life, like breathing. The AED prompts you to analyze again. Another trained responder is available to take over compressions. EMS personnel arrive and begin their care of the person. You are alone and too tired to continue, or the scene becomes unsafe.
A person who is severely bleeding can die within 2 to 5 minutes. It's therefore important that bleeding is recognized and stopped during the primary assessment. In other words, immediately after putting on PPE and ensuring that the scene is safe. Minor bleeding. Bleeding that is minor can be controlled whether by gauze or by compression. There are multiple types of gauze such as compressive, dressing, cohesive, Coflex, and many more. It's out of the scope of this training for a patroller to understand the different types of gauze and their uses. However, the only type that will be used is a gauze dressing. In order to stop bleeding, such as a small laceration on a finger from using a knife, you can easily apply gauze and expect the bleeding to slow and stop completely. Severe bleeding is the result of a traumatic injury. A skier loses control on a crowded run, resulting in a fall. An inexperienced skier, unable to avoid the fallen skier, runs over their arm. The edge of the second skier's ski cuts the medial or inner side of the fallen skier's arm, resulting in the artery in his arm being cut. Bleeding that is severe is usually more red because of its higher oxygen saturation compared to minor bleeding, and that's because it's coming from arteries. Symptoms of severe bleeding usually include the patient starting to go into shock, blood will pool, and this is bleeding that's not easily able to be stopped. If not able to be controlled by gauze and compression, you can apply a tourniquet. A tourniquet is similar to a belt that is worn on the waist, except it can be tightened to completely cut off circulation in the arm. A pulse should not be felt when a tourniquet is put onto an arm. If you put a tourniquet onto someone's arm, you should put it 2 inches above the wound, but not onto a joint like the shoulder or the elbow. Once tightened, you will need to record the time it was put on, and do not loosen it. Usually, the patient will begin to go into shock because of the high amount of blood loss. Patients that experience severe bleeding should be prepared to be treated for shock, such as providing a blanket to keep warm. A tourniquet can only be applied to the limbs, i.e. the arms and the legs. Bleeding on the neck or anywhere else that a tourniquet cannot be put should be controlled by packing the wound with gauze and pressure. It is possible to make homemade tourniquets, however they usually do not work and should not be used. Belts are not alternates to tourniquets and do not have anywhere near enough pressure to stop bleeding. It would be more effective to pack a wound with gauze. First, close the trail at the spools. In other words, click on the spool to close the trail at the top. After doing that, sweep the trail. Ski across the entire trail to ensure that there are no skiers present. If a skier is present, escort them until they exit the trail. Night skiing trails do not close. Before night skiing, day trails close at 4 p.m. Trails are closed from dusk to dawn. Pine River officially operates from 9 a.m. to 9 p.m., though these hours may change. And supervisors will talk to you on when to begin slope closure. Staff can be striked for breaking rules usually for operating things in the game that they are not allowed to operate. Staff can also receive a strike for using a snowmobile, a lift, arguing with people, using snowmaking equipment, and so forth. A supervisor will strike you, and you will be notified on the strike-specific channel. You can receive 2 strikes, but on the 3rd, you will be terminated. Staff are required to use voice chat on Discord during operations. You should rely on your own knowledge to determine your location. If unsure, you can use the map system by clicking on it on the bottom right or by pressing M. Ski Patrol is not allowed to administer medication, even as simple as Tylenol. However, you may assist with patient medication. If a patient is having an asthma attack and has an inhaler, you may assist them with it. However, Ski Patrol can never give medication. During the scene size up, ask, is there risk of you getting hurt? Have you initiated standard precautions? And do you need to triage? During the primary assessment, have life-threatening issues been addressed? Did you introduce yourself? Did you ask for consent? Have you rapidly evaluated the patient? Do you remember your ABCDs? Have you identified the chief complaint? And finally, have you updated dispatch with any important information such as location, additional resources, or patient information? History taking. Does the patient have any medical conditions such as heart disease or asthma? Have they had any surgeries? Have you identified if the patient takes any medication? Secondary assessment. Have you remembered to use sample? Have you assessed their vitals, including blood pressure, heart rate, respiratory rate, and temperature? And finally, have you done your head-to-toe assessment? And finally, reassessment. Have you rechecked vitals every 15 minutes or every 5 minutes for unstable patients?
Congratulations on completing the Outdoor Emergency Care training video. You will now need to complete the course provided to you by your instructor. You should inform them that you're done with the training, and then they will DM you a Google form in order to take the test. As a reminder, you must score over 80% on it to pass. Anything less or equal to a 70% will result in a discontinuation from the training program.